Donji, you have the floor for 2.5 minutes.
Well, first, I want to thank all of the witnesses for the important work they do in serving our communities. And I'm going to go back to you, Dr. Sereda. You got cut off a few times on yes or no answers, and I'm going to cede the next 2.5 minutes to you if you want to follow up with some of those responses that you weren't able to complete, and anything else you'd like to add.
I was really thinking hard about what I want to leave this committee with. And I think it's important that, our program, Safe Supply Clinicians, we see the deaths of so many people who cannot access safe supply because we still know them and we still care for them. And when these people die, Mr. Johns, we identify their bodies. As I said, we call their mothers, we plan their memorials, and we don't sleep because we don't know who is going to be dead in the morning. And the next day we get out of bed and we wipe our tears and we go back outside and we put our knees on the dirty pavement and we do CPR again and again and again. And we've been doing this for 8 years. 8 years. And I'm sorry, I used to keep a list of the dead on my office wall because I didn't want to forget them. But I ran out of paper, or I ran out of room to put that paper on my office wall, and I ran out of maybe the emotional fortitude to look at it every day. So I took it down and I put it away because it was too much. But even that empty space on the wall still says something to me. It tells me about the people we have not been able to save, and we cannot forget these people. We cannot forget these in the rhetorical discussions that we're seeing, in the misinformation. Those people are dead, and we're not getting them back. We have 42,000 dead. We lost 44,000 Canadians in World War II. In less than a year, we're going to lose more Canadians than we did in the entirety of World War II. So this crisis, it's producing mass death, and it's forever traumatizing those of us who care for them, their families and their communities, the frontline healthcare workers. We are working so hard to save every single life that we can. And so if I can leave this committee with anything, it's to rely on the actual scientific evidence and the expert evidence that is brought to you here, and not the media, and not misinformation, and not anecdotes, and not stigmatizing discourse. I want you to all picture that blank space on my office wall of the names I can no longer look at. Thank you.
Thank you very much.